How does predictive genetic testing find predisposition? Have you ever wondered how scientists can predict if someone might develop certain health conditions? Predictive genetic testing is a fascinating process that helps answer that question. This type of testing looks at a person's DNA to identify specific gene mutations that could increase the risk of developing certain diseases. The journey begins with a family member who has a known genetic disorder. By identifying the exact genetic variant linked to that condition, healthcare providers can focus on those specific mutations when testing other family members. This targeted approach means that instead of scanning the entire genome, the test only checks for those known mutations. This method increases the accuracy of the results. Typically, a blood sample is collected from the individual being tested. This sample is then sent to a genetics laboratory where trained professionals analyze the DNA. They look for changes in the DNA sequence, known as gene mutations. These mutations can affect how proteins function in the body, which can lead to various health issues. Some mutations are associated with an increased risk of developing conditions like certain cancers, heart diseases, or neurological disorders. If a mutation is found, it indicates a genetic predisposition to that condition. However, it is important to note that having a mutation does not guarantee that a person will develop the disease. It simply means there is a higher risk. Predictive genetic testing is especially useful in several situations. For instance, if a condition can be prevented or treated effectively when detected early, this testing can be a game changer. It also helps individuals make informed decisions about their health care and family planning. Many people want to understand their future health risks so they can take preventive actions. This type of testing is different from diagnostic genetic testing, which is used for individuals already showing symptoms of a condition. It also differs from carrier testing, which identifies individuals who carry one copy of a mutation for recessive conditions but usually do not develop the disease themselves. For families, predictive genetic testing can guide personalized screening schedules and preventive measures. For example, if someone tests positive for a mutation linked to hereditary breast cancer, they may start having mammograms at an earlier age or consider preventive treatments. In summary, predictive genetic testing plays an important role in understanding hereditary health risks. It provides information that can influence medical care and life decisions. However, it is essential to interpret the results carefully and seek counseling to understand the implications fully.